Namaste, Sasrikal, or Assalamualaikum. Welcome to another episode of Ask Dr. Sandy. So another question I often get as well is about things like numbness or tingling in the arms or hands. Sometimes that's also known as carpal tunnel syndrome, or if it's on both sides, it's called double crush syndrome. So what's actually happening? So if we look neurologically, if the spine over time has started to shift and misalign and compress the nerves coming from C4, C5, C6, and C7, it goes into the arms and hands. And if it stays there long enough, you'll hear patients complain of weakness, power issues, pain. They can't lift things, constant pain. And if it gets bad enough, you'll see numbness and tingling. Now, medically, if there is a type of shift or misalignment in the spine, they'll usually recommend maybe heat, possibly ice. They may recommend some medication. If it gets bad enough, they may even say injection. And then the last resort, which even doctors don't want to do right away, would be a surgery. So the great thing in chiropractic, if you can get to someone early enough, if it's not an end stage situation, it's a gentle, natural way to work with the body, gently getting the spinal column back into place after the doctor's done a proper analysis with x-rays, with computer scans, seeing where that problem is, and gently over time removing the pressure. That will start to help with the arms and hands. And it can actually help someone reduce medication and possibly avoid a surgery. So what's interesting is that same network, though, also overlaps with the lungs. It can affect breathing systems. One thing I've also observed as well, and if you talk to most chiropractors, they'll mention this, is that chronic pressure on the spinal cord also affects energy systems. Because if you think about it, any type of pressure on the cord, disc bulging anywhere in the system, it's not efficient. The body has to work harder just to do baseline activities. So you'll see people complain that, well, yeah, you know what, we're having issues with the arms and hands, but energy's been impacted. And if that gets impacted, sleep, focus, memory, even mood can get impacted. When someone has chronic levels of pain, chronic levels of being tired, it has a huge impact on the mood. And to me, that has nothing to do with quality of life. We want to prevent it. And again, yes, in certain situations, drugs and surgery are there. It should always, always be a last resort. I tell all my patients, and most chiropractors would agree with me, you always want to try something natural, conservative, and then drugs, and then obviously the last resort would be a surgery. And again, with that area as well, what are things that would even cause this to shift? So that area, we're seeing it more than ever. Why? More people are on a computer more than ever. So long time in front of a computer, which I'd probably say 80% of people are on a computer on a regular basis. A long drive to work. I've met people where they're driving, 1 hour one way, 1 hour the other way, sometimes even longer. So that's very, very hard on the system. People are on their cell phones for a longer period of time. So they'll actually have a job where all day in front of a computer, go home, sit down with the family, go watch TV, and then again on the computer, on their phone for hours and hours. So it's very, very hard on the system. That would be physical. The next would be emotional. So obviously, living a North American lifestyle, by the time you do your career, your job, see the family, make sure everything's okay, we're always busy, busy, busy. So that constant stress, very, very hard on the spine as well. I would say it's probably the #1 thing that damages the nerve system is constant stress, being on the go, a lot of things on our mind. It actually causes the spine to shift. It overstimulates that area, and we start to see health problems develop. The last category that affects the spinal column as well in the neurology is your diet. So we know we should be eating water, we should be having greens and things like that. When we're not having the best food, and I've talked about this for years and years, and I'm going to keep talking about it, caffeine is very hard on the neurology. So having tea, having coffee, very hard on the system. All of this affects the nervous system. So God bless. I will see you next week with another episode of Dr. Sandy.